Hello, Matthew Bell here with Alzheimer'sProof.com, and today I wanted to discuss a few interrelated definitions. So the first is going to be long-term care. What do we mean by that? How is that word used? The second is going to be custodial care, and it's sometimes used as a synonym for long-term care, and sometimes it's used a little bit differently, depending on the context. And the third is skilled care. I want to try and make this as intuitive as I possibly can. So the first thing I would like is to think about what do we mean by long-term care. And I'm going to use an example, and it's going to be a personal example. So as many of you know, my dad Jim passed of Alzheimer's disease in 2016. And my grandma actually just passed in June of this year. I'm recording this now in September of 2019. She passed in June. She had Alzheimer's disease. She didn't die from it the same way as my dad did. But when we think about long-term care, think about what that phrase implies. So long-term care is going to be care that is delivered over a fairly long period of time. So what's in view here is a person who has, let's say, a chronic condition, disease, disability, something that's going to require their care over a long period of time. And often these conditions are going to be terminal illnesses or conditions. The word terminal is sometimes used in different ways. I have a separate video on how a person dies from Alzheimer's disease, and in that video there's a separate discussion where I get into what a terminal disease is and a couple of different ways of defining that and understanding that. So if you're interested in that, I invite you to check out that other video. But in general, again, a long-term illness or condition is going to be one that requires a person's care over a long period of time. Now, that is an intuitive definition for long-term care. So when you think about what kinds of care a person who has such a condition might require, then you get a little bit more specific, and let's kind of get into that. So my dad had Alzheimer's disease. So thinking just about the Alzheimer's disease, my dad was going to require both medical care and non-medical care. Now this is a key distinction. One way of using the term custodial care is care that is non-medical. On the other hand, a person who has a chronic illness may very well also require medical care. So my dad had various pharmaceutical interventions and other kinds of speech therapies and things like this that would be considered medical care, right? And we're going to get more in depth on that in just a moment. So the intuitive difference between custodial care and skilled care is going to be that custodial care is essentially this non-medical care, whereas skilled care is going to be the medical portion of care. Now, there are a few different ways of kind of getting more clear on what the differences are, and I'm going to kind of break them out this way. We're going to talk about what that actual care is, what does it look like, what does it involve, who provides the care, where the care is provided, or if you like, where you receive that kind of care, and then lastly, number 4, how do you pay for that care? So let's talk about custodial versus skilled care. But before I do that, let me just say one other word about long-term care. So sometimes the word long-term care is used to encompass both of these things, both custodial and skilled care. Other times, the word long-term care is essentially used as a synonym for custodial care. So the very first pitfall, I suppose, in using these words is to understand that depending on the context, the phrase or the word long-term care may be used in a broad sense to cover whatever your loved one may need or what you may need over a long period of time. And again, that could be medical or non-medical. And it can also be used as a synonym for non-medical care, that custodial piece. So what is custodial care, right? Well, let me get to this question, this answer, by reminding readers that to qualify for long-term care, and when we think about qualify for long-term care, what I mean here is essentially what are the diagnostic triggers that would prompt a doctor to say, yes, this person's in need of long-term care. Now that's an important classification, especially for people who may have private insurance policies that cover long-term care, because the question is going to be, when does that policy kick in? And generally speaking, there are going to be 2 different triggers for calling a person long-term care qualified. And the first trigger, and I've gone into this in other places, is going to be physical, and the second trigger is going to be basically cognitive. So with respect to the physical trigger, there are 6 what are called activities of daily living, right? And to be long-term care qualified essentially means that you lack 2 out of these 6 these activities of daily living, that you cannot perform 2 out of these 6 of these on your own. And these are going to be things like bathing by yourself, dressing by yourself, feeding yourself, toileting by yourself, being able to transfer in and out of bed by yourself, and number 6, being able to control your bodily functions, or what we call continence, okay, being continent. So if you lack 2 out of 6 of those, you may be long-term care certified from a physical standpoint. The cognitive standpoint can be quite different. It has to do with having a cognitive impairment to a significant enough degree that you would require supervision in order not to hurt yourself or other people. And in my dad's case, he was physically there was nothing he could do, all of the activities of daily living essentially physically. His problem initially was cognitive, and then of course as the disease progressed, his condition worsened, and he met the qualification multiple times over, and this is not uncommon. So now, when you think of these activities of daily living, then, bathing by yourself, dressing, feeding, and so on, we see that in the sense of custodial care is going to be that kind of care that's going to assist a person in receiving and in performing the activities of daily living. So the first thing that you should understand is custodial care is geared towards those basic activities, those basic daily functions of life, essentially. Being able to keep yourself clean. I mean, that it's not just about bathing, it's about hygiene in general. Being able to feed yourself, obviously, is essential. Being able to dress yourself appropriately for the environment, for different climates and the like of this, meteorological conditions and so on. So all of these affect a person's well-being, and when a person is unable to perform a subset of these on his or her own, then they are going to require help, and that help is considered to be non-medical and custodial. And in some cases, again, like I said, that's what's referred to as long-term care. However, like I started off by saying, my dad, Jim, has or had Alzheimer's disease, which affected his ability to be able to exist in a day-to-day environment by himself. And so at the same time, that condition, that Alzheimer's disease, also prompted and necessitated that he be given certain pharmaceutical interventions. So he was on pharmaceutical drugs. Aricept, for example, was one. And so that drug had to be administered to him at various times in the day. Now, of course, family members are able to administer that kind of medication. But in a care situation, you wouldn't want a person who doesn't have proper licensing and proper credentials to administer drugs to your loved one. So the kinds of people who provide long-term care in the sense of custodial care, the kinds of people who are going to help to bathe a person or to help feed a person, they don't actually need to be licensed. So a second difference right off the bat, or a second distinguishing feature of custodial care, is going to be that the care practitioners do not need to be licensed. Now, I'm going to start to draw the contrast here with skilled care. So skilled care is the medical portion of this. So the skilled care is going to be that care which is going to be involved in administering pharmaceuticals, dressing wounds, maybe running certain tests on a person, drawing blood, administering vaccinations and the like of this. This is going to be skilled care, at least skilled nursing care, right? Now, when we also talked about the requirement in terms of licensing, we said custodial care providers don't need to be licensed to do what they do. You don't need a license to help somebody get dressed. You don't need a license to help somebody get out of bed, at least at the present time. And yet, on the other hand, for skilled care, so for example, wound dressing and administering medications and the like of that, you do require special training and licensing. And so that is what is referred to as skilled care. Now, once again, in certain care environments, you're going to see a combination of these needs being met. So for instance, my dad, when he resided in a nursing home, so a nursing home is a place that is going to provide residential services, it's going to provide custodial services, it's going to provide skilled medical services, because it's kind of a one-stop shop. And that is one of the reasons why sometimes these definitions get a bit mixed up, because of the fact that you see your loved one or you see somebody in a particular care environment and you assume, well, that whole shebang is long-term care. The point is in some cases what is going to be relevant is to the question of who pays for some of these services. And this is where the distinction between custodial and skilled care is going to become extremely important. But before I get to that extremely important distinction, let me just talk through a couple of the possible care environments in which a person might find him or herself. Number one is in the home. And of course, in the home, you can have people come to the home to provide the kinds of custodial supports that a person might need. Now, generally speaking, if you're receiving care in the home, this is probably going to be a supplement in terms of, like, when my dad was living in the home, it was my mom and I, basically, who were giving the supports that were necessary for him to get through the day. But if we needed additional help, then we might call somebody else into the house. But we were able to deliver care in the home at first because of our involvement, right? But you might have a nurse come, in which case you might receive skilled care in the home. You might have somebody come to help with some of the custodial or daily living tasks. So you might receive both custodial and skilled care in a home environment. In an assisted living facility. So the assisted living facility is essentially a place that's going to help people who are starting to have difficulty with the activities of daily living. So essentially in an assisted living, they're going to try and emphasize independence. Sometimes people talk about various requirements like being able to get to an exit by yourself, and along the lines of this, in terms of whether or not a person would be safe to reside in an assisted living facility, or whether they require a higher level of care. This video is not about assisted living particularly, so I'm going to kind of put a pin on some of these questions. But essentially, in an assisted living facility, that this facility is going to be geared towards some of these activities of daily living. Now, the third care environment is going to be in a nursing home. So now there are other kinds of options. There's respite care and hospice and that, but those, even though they're relevant to a complete discussion, I'm going to sideline those discussions as well. Respite care, of course, is care that a primary caretaker would utilize if he or she needs to take a break for some reason. So if I'm the primary caretaker of my dad and I have to travel out of state for some business purpose or for some reason, then I can't take my dad, let's say, so I have to then put him into a respite care facility that is going to take over the tasks of caring for him while I am on a brief hiatus, so to speak. Hospice, of course, is going to be primarily they're thought of as end-of-life caretakers. I can tell you from our experience with my dad, my family's experience, that my dad went in and out of hospice a number of times. When a person goes into a care facility, they usually record that person's baseline, which is going to be the amount of food that they eat, the amount of water they drink, their weight, and their level of mobility, I suppose. And then once a person starts to decline to a certain level, hospice might kick in, and hospice can kind of bring that person back up to their baseline. And if they do that, and that's what happened to my dad was in and out of hospice a number of times. Now, the final time, of course, ended with his death. But again, I'm going to sideline a more detailed discussion of any of those things and simply say that the third care environment is going to be a nursing home. Now, a nursing home is going to provide a level of care that's going to be a notch above in terms of comprehensiveness what an assisted living facility is likely to provide. So in a nursing home, you will certainly receive both custodial and potentially skilled care. And so what is in view here is a combination of services that, again, include both medical or skilled services and non-medical or custodial services to help a person who has got a chronic condition, disability, or disease, to help them not just get through their individual days, but to basically provide comprehensive care and a place for them to live. So once again, a nursing home is going to have all those things mixed together. It's going to be both a residence for them, a custodial care support facility, and a medical or skilled nursing care support facility. Now, why are these distinctions so important? Well, the distinctions become important largely when it comes time to try to pay the bill. And this is going to come out and fall out in a number of different ways. But here's the bottom line. If you're going to pay, and I've said in other places, and I have a separate video on this, there are three main ways to pay for long-term care. You either pay for it yourself out of your own income and assets, we'll call that private pay. You pay for it by spending your assets down and qualifying for Medicaid, which is a government program that is designed to compensate people and help people who have basically who are impoverished to pay for essential medical care. Or the third is that you have a long-term care policy. Okay, now if you're paying out of pocket and you're paying privately, you've got your own income and asset stream, you're in a nursing facility, then it doesn't matter whether you're being billed for skilled nursing services or custodial services because you are paying out of pocket for everything. That bill is going to be a composite, and one portion of the bill is going to be services that were provided to support activities of daily living. It's going to be a non-medical kind of a bill. Then another portion of the bill quite likely is going to include skilled care and medical services. So if you're paying out of pocket, both of those two services are coming out of your pocket, and the distinction really doesn't matter. Okay? On the other hand, if you are relying on government aid, then what you need to understand is that Medicare, for instance, Medicare only covers the medical portion of that bill. So Medicare is going to cover a portion of some of the skilled services. And this is the similar statement we can make about health insurance. So your health insurance is going to be able to pay for certain services that are medical services, skilled services, services that are delivered by a doctor, a nurse, some kind of a therapist, a speech therapist, occupational therapist, physical therapist, something like this, that might be brought in order to help a person with a particular ailment to gain perhaps a higher level of functionality. Now, one thing about Medicare that's important is that Medicare generally covers interventions that are designed to be curative. So if the person has the potential of improving, then Medicare will cover it. And if the intervention is simply to ease pain or what's sometimes called palliative treatment, then Medicare is often not going to cover that. Now, I'm not an expert on Medicare here, but I guess what I'm saying is when you think about a bill in a nursing home, the issue is where are you going to get the funds to pay both for the non-medical and medical services. And even if it may be true that for the medical portion of your bill, you may get some help from health insurance, some help from Medicare, it's also the case that the non-medical or custodial portion is not going to be covered by Medicare or by your health insurance. So you're either going to have to private pay that portion of it, or you're going to have to, again, spend your assets down to a point where you can qualify for Medicaid. Medicaid does pay for the custodial portion, or at least they'll pay for a portion of it once you have spent your assets down and once your other income and other assets are being spent towards your care. So if you receive a Social Security check, as my dad did, that's also going to go towards your care. Medicaid will kind of kick in the difference. Now, the third type of way to pay is going to be with the proceeds from a long-term care insurance policy. Now, I get more in depth than this in other places, but essentially what I want to talk about here is long-term care insurance is the kind of insurance that's going to help you to pay for that custodial non-medical portion. So if you're getting help paying for the medical or skilled care portion via your health insurance or via Medicare, then a long-term care insurance policy is able to pay for the custodial care. Now, you have to be long-term care certified in order to collect payouts from a policy of this kind, meaning you have to lack 2 out of 6 activities of daily living or be cognitively impaired, as we said. But the issue essentially, again, is whether or not a particular service is going to be considered medical, that is skilled care type service, or non-medical or custodial care. And once again, this is going to depend upon the kind of service. Custodial services, again, are things like bathing, dressing. They're going to be delivered by people who are not licensed. They may be delivered in a variety of environments, from the home to an assisted living facility to a nursing home, but ultimately those are only going to be able to be paid for through private payment, just paying out of pocket, through Medicaid after you've exhausted your own assets or through long-term care. On the other hand, you're also going to have skilled care, skilled medical care, skilled nursing care, and the like of this. That's going to be things like administering shots, giving you medicines, dressing wounds, and that kind of thing. And that kind of care, again, that kind of care will require a person delivering it to have a license, to have special training. That care may be also delivered in some of the same environments, in a home, in a nursing home primarily, but in terms of who pays for that care, that's where your health insurance, that's where Medicare is going to be more relevant. So I hope that this sketch has perhaps given you a little bit of insight. I know this is difficult, and I'm trying to keep all the threads together without being extremely confusing. One of the confusions sets in with respect to the fact, again, that long-term care as a word can be used for both things, the medical and the non-medical, and it can also be used as a strict synonym for custodial care. That's one confusion. A second confusion, essentially, is the idea that the care environment can be with both types of care. So in a nursing home, you may get both non-medical and medical care, both custodial and skilled care. And the third point of confusion can often be the fact that you're going to see both of these. So when you say pay for a nursing home, what you've got to realize is that the nursing home bill is going to be a conglomeration of itemized lines that are going, some of them going to count as non-medical and some medical, and who or what will pay for each of those is going to depend in part on their classification. So once again, I hope this video has been of service to you. If you found something of value in it, please like the video, please subscribe to the channel. I'm going to come out with additional content. If there is a need or a desire for me to clarify points in this, I may come back with a follow-up video. I invite you please to check out the other videos that I've done. I've got a number of different topics, and I intend to do more, so please check back for those, and I appreciate your time today.